Alrighty, welcome everyone to the third episode of the Chronicles. I appreciate everyone who's been giving it likes and commenting and giving me messages on what I'm doing over here, and I appreciate it. I did two videos back to back, and then I took a few days break because I realized there was just kind of a lot of shit moving all at once, and there was updates by the hour, even at nighttime. Even as I was prepping for this one, so a few hours ago, there was more stuff coming out, which we'll talk about here a little bit. Now, again, I'm going to start it off like I start off most of them. I don't think I'm dumb at all. I think I'm smart, but I don't always have the time to really deep dive into current events and world events. But as of late, most of us have had time to kind of just stay at home and chill. At least I have. So I figured I'd educate myself, and I don't have a particular view on anything. I'm just going through articles that are seem to be verified and fact checked, and then I double check still, and then I make my own opinion, and then I ask people who are smarter than me about shit I don't know, so maybe they can give me their perspective. We can all be locked in our perspective sometimes, but as of March 20th, Vice President Pence, who's also leading the COVID task force for the U.S., had a member of his staff test positive for the virus on the 20th. So that was yesterday. And then today, a few hours ago, he also said that he and his wife were going to get tested, for the virus, which a lot of people were, criticizing. Hey, how are you leading this task force? And here you are, people of your own staff coming up positive for the virus. I think that's going to have a lot to deal with testing. So, here's an example, right? So, when I started this podcast earlier this week in the U.S., there's 4,000, 4,500 maybe cases. As of now, there's upwards of 24,000 cases. So jumped up by 20,000 people, but that's not necessarily that the virus is spreading. It's that more tests are being done, and those tests are coming back positive. It doesn't necessarily mean that things are getting worse. It just means, at least for what's happening, we're getting a better idea of how many people really are sick and who are or aren't showing symptoms. U.S. intelligence reports have, since January, had been warning Trump. Trump and pals kind of just shrugged it off. They're like, nah, we'll be fine. Let's see if I can pull that one up here for the people watching along, and then I'll read it out for the podcast. Oh, interesting. Here, I'm gonna peep it over for the multi-eyes real quick. Let's see. So as I'm looking it up, there's one here for Texas. Texas case count. So, as y'all know, this is my state. Texas COVID. People tested 6,500. Public labs, private labs. Number does not include the nodal or the total tested by all. So I'm on the Texas Health and Human Services website, and looks like they have a dedicated page here for COVID-19. I'm seeing a lot of sites do that, so that's good. So statewide, apparently here in Texas, we have 304 and 5 deaths so far. And here are all the counties. There's Bexar. So Bexar County has 22. I'm only going to see the 22. Collin County is 13 in the double digits. Dallas County has 29. Looks like probably the highest in Texas. Denton County, 9 cases. Fort Bend, 11. El Paso, 8. Let's see, Harris also with 25. Travis with 22. And then pending county assignment means 83. So there's 83 other people who aren't broken down by county. So following California's lead, Connecticut, Illinois, and New York have followed the shelter-in-place order for their state, which basically means it's not putting the whole state under quarantine, but it is saying, hey, for non-essential travels, even social travel, even if you're trying to go your friend's house, try not to take shelter in place. Stay indoors as much as possible. I mean, you have to go out, you have to walk your pets, you have to exercise, which is cool that the show letting people, you can still go out and running and do all that, but the recommendation is to shelter in place. We have a few states following that. Texas governor, so my governor, said the other day that Texas now has the right, or he now has the right to quarantine Texas, but he says he doesn't want to do that, and that he will have to enforce more aggressive measures if Texans can't be responsible. Now, I've been a Texan for a while. I'm not saying we aren't responsible. We like to have fun because we're Texans now. That's no excuse. That's gonna fucking suck if we really have to go under quarantine. And I'm sure y'all have seen the videos already of the spring breakers that are like 18, 19, 20, 21, whatever, on spring break. And the one dude's like, yeah, fuck the coronavirus. It doesn't fucking matter. I'm going to get fucked up. It's going to be a fun fucking time. And that other girl who's saying the same fucking thing, seeing how people are being irresponsible right now as it is, especially the younger crowds, because they think they're immune to the virus, and no one's immune to the virus. Just because you are showing no symptoms, like anyone listening to this, if you haven't been tested yet, if you feel completely fine, number one, it's a good thing. Let's hope you stay feeling that way. You could also possibly have the virus in you. And while you might not ever show any symptoms, it could be passed through to someone in your family. And it would be more or less catastrophic if it was transmitted to someone in your family who has underlying health disorders or syndromes, or the elderly in your family, or the most recent pregnant. All depends, whole lot of things. See, New York having the most infected people yesterday was at 7,800. I'm going to go ahead and pull up our little map here and here. So you can see here in the U.S., we're at about 24,000 new cases, 24/7. They've officially been declared, I believe as of yesterday, a federal disaster area, meaning that that releases a bunch of funds that New York can now use to not necessarily build more hospitals. He was talking about that yesterday, because that's going to be harder than just occupying other buildings, especially since a lot of people aren't going to work right now. As far as the stimulus package, real quick, because I know in episode 2 we talked about the stimulus package and what it meant, and what was coming. Nothing's been signed yet. Nothing's been placed in order and is in action yet. They're hoping to come up with something over this weekend, and Monday they're going to come to a vote to it, and hopefully with that vote, then we'll have some more information. After that vote happens on Monday, I'll do some research and I'll make another video. Not only the U.S. and Italy's also one of the worst impacted right now. Death rates are growing frighteningly high. Death rates are increasing frighteningly. God damn it, frightening. I can't say that. It's scary. It's scary up in Italy right now because a lot of people are dying. But even the UK launched a nationwide lockdown, closing down all like bistros, bars, restaurants, cafes, all that shit. They're doing the same thing, and that's the entire nation. So whole bunch of people right now are locked down, not just here, across the entire planet. I was watching side note. I was watching the Joe Rogan podcast, and I forgot who he was interviewing. It's one of his newest ones. Speaking about the coronavirus. They talked about how this is kind of starting to give people a sense of what it's like to not live in a first world country where you can like only go out in certain times, or you go to a market to look for something, to buy something, but there's none of it. And I thought it was interesting because, as a kid, growing up in Peru, and then, at least for the summers, and then when my folks would leave me there, and then hanging out with my uncle who lives in the actual Amazon in Peru, and kind of going through those, things. It wasn't like a problem, right? Because there wasn't a famine, which was like, oh, it wasn't here. We have to go over here. We have to go over here. But I thought that was super interesting. These malaria drugs that have or haven't been approved by Trump, I don't even really know what that means. I'm going to play a little clip here where Trump talks about approving it, but then FDA says something completely different. I'll let it roll here.
we're going to be able to make that drug available almost immediately. And that's where the FDA has been so great. They've gone through the approval process. It's been approved. And they did it. They took it down from many, many months to immediate. So we're going to be able to make that drug available by prescription or states. I spoke with Governor Cuomo about it at great length last night. And he wants to be right on he wants to be first on the line. And so I think that's there's tremendous promise based on the results and other tests. There's tremendous promise. And normally the FDA would take a long time to approve something like that. And it was approved very, very quickly, and it's now approved.
Okay, so we hear there, right, that he's saying it was approved very quickly and it is now approved. See, but if you go to the actual FDA website here, and it's speaking specifically on the President Trump's aggressive response, they have a statement here that says, while there are no FDA-approved therapeutics or drugs to treat, cure, or prevent COVID-19, there are several FDA-approved treatments that may help ease the symptoms from a supportive care perspective. And that was put out, right after Trump said that, the 19th, and they're like, no. Let's make it clear that that's not something that we really have going on. They're working on it. They're absolutely working on a cure, but there's nothing that's official that has been approved that is being rolled out. I mean, it's good hopes, right? Like I want it to happen. I want there to be that, but that's false hope. Another here fact checker. It's not true that the drug has been approved and that it's ready to ship out. And the drug they're actually talking about is chloroquine or something like that. I think you heard Trump say it. It was used as an anti-malaria drug. That's all I've got as far as news. As far as some sidebars, so I live in Texas, where it's not huge yet. Like it hasn't blown up, but it's starting to emerge in certain places, and I imagine that's because there's just been a lack of testing, so we don't have an accurate number. But before I started this podcast, I decided to just take a walk to the corner store real quick, and I'm seeing like on YouTube where people are going to stores and they're running out of toilet paper, they're running out of hand sanitizer, they're running out of cleaning supplies, out of this, out of that, and I just thought it was like, oh, the people are freaking out, the people are lacking common sense. That's my opinion, and what they should be doing now. And so I walk into the corner store, and as soon as I walk into the corner store, I'm like, using the ATM, and I hear the guy at the register pick up the phone, and he's, saying, hey, welcome to, or thanks for calling so-and-so. And he starts saying, like, no, ma'am, we're out of toilet paper. We're out of hand sanitizer. We're out of cleaning supplies. We're out of, surgical things. We're out of this. We're out of that. Water. And I'm like, what? Like, and I'm at the ATM, so I haven't even, like, walked into the store yet, right? I mean, I'm in the store, but I haven't gone through the aisles or anything. And then I'm like, what? That's crazy. I finish using ATM, and I start walking through, and sure enough, and here's a picture. But it's just the bath tissue thing is completely empty. And I'm like, what? There's like 13 active cases in my county, right? There's not a lot of confirmation, but all these things are completely gone off the racks, off the fucking drawers, or the trays off the table. They're gone. People are buying them. It's crazy. I have someone that I follow on social media, Aldi Goth. I believe that's her name. She's rad because she's been putting in like 15-hour days working at Aldi, like packing, unpacking, getting all these supplies ready so people can come in and purchase. That's important these days. So we appreciate all your hard work. Give her a shout out for her being rad. But even I was on one of her stories, she was talking about how people are just kind of being dicks. Like, what, didn't you have any meat or some toilet paper? Like, I thought you had some earlier. And yeah, they probably did. But people are panic buying so much. So don't do that. Just chill. That's the best thing we can do. Social distance is an important behavior to practice right now. you see me and my 2 New York hats. You might see my cat jump in and every so often, but that's about it. I'm not going out if I don't have to. I just, like I said, I decided to go out and go on a walk to the store. I got some cat food that I was running low on for my cat, so make sure he's gonna be okay during all this. That's really about it. I don't have any good ideas on what's gonna happen next or what we should expect. Because we're all kind of in the dark, and I think we're all moving a step at a time. And I think when we're expecting leadership from our government, some feel like we're getting it, some feel like we're not getting it, and some are just confused. And I'm just trying to answer those questions I'm confused about myself. But I appreciate everyone tagging along. Again, if you're watching this, you can catch it on Spotify. If you're on Spotify, you can catch it on YouTube. This is live streamed, and then after I cut it up, I cut out all my uhs and dums and all my b's and bahs, and make it all great for you. But aside from that, I appreciate y'all coming by and checking out the 3rd episode of the Corona Chronicles, and I will see y'all on the next one, and see y'all very soon. Peace.